Today, I'd like to do a two-part series about what I call the villains of pregnancy. I came up with the villains of pregnancy when I was writing my book, What You Don't Expect When You're Expecting, little play on words. It was released in 2018. It took me 3 years to write because I had it vetted by some of my local OBGYN friends, my midwife friends, because I wanted to make sure that it was accurate and I wanted to make sure that it was ethical and that it wasn't going to hurt anybody. Because giving instructions out about your body during pregnancy is really important. And in future episodes, I'll be going over how you can find a good practitioner you can trust, that you can entrust with your health while you're pregnant, that you know you're going to somebody who specializes instead of does. That's always a pet peeve of mine when people say they do pregnancy. All I do is pregnancy. So you need somebody who really, that's their life. That's their jam. That's their superpower. So, as I said, all I do is pregnancy. And I do it in a different way. So a little background is, as I said, I'm a chiropractor. I was a paramedic from 1996. Just retired in terms of my license in Pennsylvania. Used to be the president of an ambulance. So I have a medical background and a chiropractic background with sports medicine. Additionally, I was a Act 6 reviewer. So I've appeared in front of a lot of insurance committees to fight for access to ethical, evidence-based chiropractic care. So I'm sort of a interesting person to come at this. The biggest role that I have that contributes to my knowledge is that of being a mom and going through two really difficult pregnancies, one with a car accident and one with almost losing, and then ended up having that one at 34 weeks with my preeclampsia. So I've been through it, and I've uniquely been in the position that I hope I'm speaking to somebody out there that you are faced with one of the most awful decisions or one of the hardest decisions you're ever going to deal with, which is that you got pregnant and you didn't expect that you'd have any issues till the end of your pregnancy. And surprise, something happens either medically or musculoskeletally. And my focus and my wheelhouse is the musculoskeletal part. So if you have any questions about the other parts, your OB or your midwife probably be the best person to ask about that. But my expertise is with musculoskeletal issues that affect pregnancy. So how does it lead into the villains of pregnancy? So if anybody knows me in real life, I am somebody that loves to laugh. I try to be professional. If something is a very serious topic, I will be serious with that. I'm serious minded, lighthearted. Thank you, Shannon Waller. But I love to laugh. I love to teach. I love to do analogies so that it really anchors learning instead of talking at people. I like to have chats. Whenever I talk, I've spoken in front of over 1,000 people. I have chats because it's a discussion, it's a dance, and learning is a dance. It's imparting knowledge both ways. And I've learned more from my patients over the years, their partners, their providers. So I'm uniquely positioned that I know this. I don't know everything, but I want to share what I know. And as I continue to learn, I want to keep sharing. So I've been packaging that material as I taught patients and chiropractors. And I decided I got this crazy idea because a lot of times in practice, I'm not a traditional chiropractic in any sense, both in philosophy, but also as a human being. And one thing I like to do is really hit home. So, one funny fact about me is if somebody comes in and they're like, my ex-husband stressed me out, or my boss is stressing me out, or my manager is stressing me out, when I'm working on their back and doing muscle work and like digging out this knot aggressively, we talk about that person. And I let them talk about that person, and we can equally be mad I have one person, their ex-husband. I love when she comes in. I hate that stresses her out so much that she ends up having rib pain and sharp pain in her back every time she has to deal with him. Well, let's call him Bob. Every time she comes in, I'm like, we're railing at Bob, and I'm like, I'm putting a hurting on Bob. So it allows her to have humor in the moment that the person she perceives, obviously we are responsible for ourselves, but the person that's causing her stress, we can physically remove him from her body. And from that idea, I was like, why don't we make these villains? I originally made myself a cartoon, not so much a superhero, but a cartoon, because I have a face for radio, I felt like, and I really didn't want to be on any kind of video. I'm not a huge front facing person. I like being behind the scenes. I built my practice behind the scenes. I like practicing in treatment rooms. I don't like being out there, which is part of the reason why I haven't done any of this. Not because I don't care, not because I wouldn't say I'm scared. It's really a lot for me to put myself on stage in a video way. And it's been hard. Like I can talk to audiences. It's just to say stuff and have it be understood that there's no harm in it is difficult. And so back to the story, because I was doing that with patients and they were reporting such satisfaction with having the awareness of how they let other people affect their bodies, right? And we could share in a common hatred, temporary hatred of Bob or whoever they were complaining about. I'm like, why don't I come up with the villains of pregnancy? Since I'm a cartoon, let me come up with these villains that my patient, my reader, my audience participant can get behind and be like, I hate that woman. I hate that Linda low back pain. I hate that Sally sciatica. And this is her characteristics. In school, I was a tutor. As I said before, I like to anchor knowledge for people. I like them to understand. And maybe it'll take a weird analogy to get them to understand. But if I can have them picture in their mind who Rebecca Rib Pain is, and that she is the Regina George of back pain, in that she is the scariest and most insidious of all the villains, and we'll get to that. When you get the sharp stabbing pain in your upper back, it's like, oh, that's Rebecca. That's beef, by the way, or Bruno, who's in my books. Bruno. It gives a face. It gives it's not real, but it's a learning anchor of like, oh, that's just Rebecca. Not, oh my God, I'm so scared, I'm being stabbed in the back, and now it's going down my arm, it's going into my head. That's what Rebecca does. And these are the things I invited Rebecca in to my life. This is how I kick her out of town. So it gave that story, that framework. So that's why I came up with the villains of pregnancy. And my sidekick, this is my book, Why Does My Kitty Still Hurt? And that's Bruno, because that's the live version. It just anchors knowledge. So I developed these villains of pregnancy. There are 6 total villains. Today I'm going to be talking about the lower body ones, which everybody expects to some extent. The last ones, they don't. But in the next episode, I'll go over the upper body villains that people don't expect or attribute to pregnancy that are common and not normal. Okay. So let me introduce the villains in total. There is Linda low back pain. All of them, by the way, are named after family members. It just happened that way. It's not because I don't like my family members, but I thought it was funny. So I have Linda low back pain. Linda was my aunt. My single tattoo that I got just a few years ago. She passed away from ALS. Just funny as hell. That is Linda low back pain. Her sister, who in real life, her real life sister, is my Aunt Sally. She lives in Missouri, southern Missouri, near the bottom border of Illinois. That's my Aunt Sally. So Linda and Sally are real sisters. I made them besties, ride or dies, because when Linda comes to town, Sally follows soon after. Sally is Linda's little sister. So those are real people. Peggy Pubis, Peggy Pubic Pain. Peggy was a family friend of ours, and she is the one that no one talks about. And all the things I've done on social media that have blown up, shockingly, are about Peggy. So I'll be talking to you about Peggy. In terms of the upper body, that is Helen Headache. Helen is my aunt who passed away in 1996. I have pictures of her all over my desk. It says Helen. That's my dad's sister. She's amazing. And then I have Rebecca Rib Pain. Rebecca is my sister-in-law who lives also in Pennsylvania. And then Wendy Wrist Pain. So Wendy is a family friend as well. So those are the most common pains that affect my patients. In order of how they happen is how I just said it. So it's Linda, Sally goes to Peggy. And then in terms of the upper body, typically Rebecca and Helen go together. Rebecca causes Helen. Wendy Wrist Pain is probably the least likely. And then in terms of the after effect, I have another book. So I'm releasing the partner book this week. What you don't expect with when you what your partner wait shit. I've had a brain. It's like 5 a.m. What your partner didn't expect and how you can help. So that's my next book that's coming out this week. The next book after that is What You Don't Expect When You're Expecting, the fourth trimester edition. And that talks about how these villains come back and hit you again. You think they left town, but they hit you again. But wait, there's more. So it gives you a framework again. Like, oh, Rebecca's back. And this is why Rebecca's back and why it's different when Rebecca shows up during pregnancy versus why Rebecca shows up after you had the baby. They're related. But if you can mitigate and be aware of why Rebecca's back or why Wendy is back. Wendy, all the upper body stuff is predominantly fourth trimester stuff. And that's why I wrote that book, is because women are often shocked. They're like, I don't understand. Started in my low back. I came to you for low back pain when I was pregnant. And now for some reason it's up here. You know, and they come back for like 2 to 3 weeks after they have the baby, and they're like, I don't understand. I have this severe pain in my back. And they're kind of scared because it's like down here with the chiropractor was okay, even though it was near the baby. But like up here, a lot of people are just like, I don't understand. Makes sense to me biomechanically, and we'll get into that. That's also in my courses. So let's go over the lower body real quick. So Linda low back pain starts out as a dull ache. It is a pressure. It's like an overstretching. Linda shows up because your body obviously is pregnant and it's far forward. It's pulling. Anytime we have stress on something, it shows up, right? So it overloads. So as you get bigger, even when your uterus starts to fill with all the fluid and the baby, that little weight on the front changes things, right? So if I strapped one of these guys to the front of these weights to the front of my belly and walked around like that, my back has to change what it's doing. Just like we just talked about it in the last episode. When something changes in your life, other things change, right? Which is a great thing. But at the same time, that's why that starts, is your gravity line moves forward. You put strain on your lower back and the muscles start to tighten down. If it goes enough, it'll start to affect the nerves. And that's how it goes into Sally sciatica. So Sally sciatica is any type of nerve pain that moves away from their origin site. That's sort of the definition of radicular pain or sciatica, because now the pain is traveling, right? It started in low back, traveling. The only caveat with that, which you'll read in my book or my courses, is when your back pain that starts out with, typically if it starts to go into the nerve pain and then the back pain goes away and you're stuck with this toothache pain in your leg and it extends past your knee, it's typically a herniated disc, which is treatable and it's workable. I have a huge one in my neck. You can come back from it easily. It takes a bit, but people have a really good recovery with that most of the time. But that's sciatica. So that's Sally sciatica is back pain that now is down your leg. The final one that people don't talk about is pubic pain. And it is common, it is most common, 5th month, second pregnancy. if I see it on the first pregnancy, it's real bad around 6, 7 months, I can almost guarantee you one thing, that that mom was some sort of high level athlete. She was a dancer, she was a gymnast, she did something, she was a horseback rider. These are things that you don't consider when you're playing sports as a teenager, that you're affecting your pelvic floor, but you are. So if I have a high level athlete, they're going to have problems on their first pregnancy because their pelvic floor is affected. It manifests as sharp pain. It starts as a pressure in your groin, kind of like if you were wearing bikini panties, right above where the little band is on your panties. If you push right underneath there, that is your pubic bone. You'll meet a bone, and just like a shin splint, right? So if you imagine a bone, the bone has ligaments on it that are attached, that are sort of a puppet show of your pelvis. And when it's under stress, right, if the pelvic floor above it is pushing and putting pressure on it, it's going to scream. And when it screams, it overloads. And it does that by getting hot. It gets edema or swelling, and it gets ticked. If you ignore it enough or the weight's too much, it's going to start to scream. And that's what they call lightning crotch. So these are things that sort of lend themselves as sort of like dominoes. It's like boom, 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 which is why I package the courses and the chapters in my book to be a unit, because when one starts, you have to be careful that it doesn't go to the other. Typically with pubic pain, I'll see that at the end, like 8 months. And you'll kind of expect that. Like it makes sense that mechanically this baby's big on your little pubis. But where it gets scary and where I can make the biggest impact, because around here they call me the crotch fixer, get a license plate for that. The problem is on your second pregnancy, you do not expect that to show up at 5 months. And I can tell you mentally that is terrifying, because when it first starts, you're like, oh, it'll go away. I overdid myself. When it lasts a couple days, you're like, so I use a different word, shit, this is going to be the next 4 to 5 months of my life. And am I going to be able to push a baby out through this extremely painful area? So there's a lot that can be done for all three. There's so much you can do for pubic pain. So that's a high level introduction to the villains. In the next episode, we're going to be talking about the upper body ones. I'm your host, Dr. Brandie, and I'm here to help, to give you the pregnancy that you dreamed of.